Hi, I'm Dr. Gloria Velazquez, and this is my journey in regards to my Ph.D. program. I started my journey back in 2013. I enrolled in Walden University in order to begin my Ph.D. journey. At that point, I started my academics. From 2013 up until 2016 was all my academic work, and that focus was to get me preparation for my dissertation that was about to come. So during that time, people had asked me multiple questions. Why did you pick this topic? Multiple reasons. I used to work for a company that I would see different types of families coming through with different pediatric issues. Also, on a personal note, I myself have my own pediatric issues with my own families, and which kind of encompasses the reason why I picked this topic. So my topic for my dissertation, which started in 2016, was Latino Caregiver Experiences, transitioning your child with disabilities from pediatric to adult systems. And that's where my journey has brought me to give you the following information on how I got the findings for my study. So I began with doing research here in the Valley, Lehigh County, Northampton County. I did speak to the different county levels to figure out what are the pediatric services that they currently have here for children. Because my goal is to figure out the experiences of caregivers in regards to transitioning their child, I'm looking at when these children turn 18 and what these families go through when they leave the pediatric systems and go into adult systems, especially with a child with disabilities, which can be more cumbersome. So as I did my research, I found out we're very saturated in a lot of pediatric help. However, once they start aging out at 18, the help seems to be less and less, especially in the Lehigh Northampton County areas. So when I did my literature research, the literature indicated caregivers have different types of stress. They're parents at the end of the day. But the caregivers have additional stress when their child has some form of a disability. So a lot of the literature reflected the lack of ethnic studies. Hence, I picked the Latino culture. It's very heavy in the Lehigh Northampton County areas. During my literature, around this time of year, 2020, 2021, the Latino minority group would be the majority group in the United States, so which added to another additional information needed in the literature to be studied. The other piece that I did find in the literature review was that caregivers' experiences during transition time were not always the best. So that led to me to develop research in exploring Latino female caregivers, transitioning their children with disabilities from pediatric to adult systems, and the focus in the Lehigh Northampton County area of Pennsylvania. Okay, so when doing my research, I came to the conclusion I want to interview 10 female caregivers who are from Latino descent between the Lehigh and Northampton County areas. So the 10 women I did have the pleasure of interviewing during this research were all identified as Puerto Rican descent, with the exception of one individual who identified herself as both Puerto Rican and Cuban. All these women, for the majority part, were working full-time. We had one individual who was working part-time, so we're looking at full-time caregivers working and transitioning a child with disability upon turning 18. Half of the women interviewed were married. The other half were either separated, divorced, or single. So just to give you a little bit of demographics of some of the caretakers that I was interviewing. So during this time, the focus was interviewing on the Latino female caregiver experience, their experience navigating the pediatric system, leaving the pediatric world per se, and going into the adult world with their child. So many areas came out of this research. There was 5 themes that came out upon interviewing these 10 women who took the time to be interviewed. All the interviews were conducted in English. All the interviews were recorded. All the women were brought back for appointments to review their transcriptions to make sure everything's captured appropriately before all the data analysis can happen for the research. So there were 5 findings to my research. One finding was related to how the caregiver experienced themselves during the transition time. Another finding was the sources of information provided to them during their transition, supports that the caregivers had during the transition period, challenges that they've encountered during the transition period, and recommendations they had for other caregivers regarding the transition period. So we break this down even further, some of the feelings that they felt through, the caregiver self-effects. In the transition, they had difficulties letting go. How do you let go your child from pediatrics to adult? When the adult services don't want to talk to you, they only want to talk to that child, and you don't have the legal paperwork in place in order to make decisions. And now your child is making decisions on their behalf, whether you agree with it or not. A lot of issues with letting go, being a Latino caregiver. The other issue was the personal feeling in regards to the emotional highs and lows, the anxiety with navigating a system, or frustrations with navigating a system. Again, pediatric systems have a lot of info, a lot of help. However, adults, not so much in this part of the state. For the information that they received, the majority of the families, or the majority of the Latino caregivers, indicated 60%, they didn't receive any information. They didn't know how to transition. They were just told in their pediatric world, you need to transition. Your child is an adult now. So they were left with, what do I do next? So some of our Latino caregivers took the initiative, about 90% of them, took the initiative to figure out how to figure out what's the next step. There's many layers when you're 18. So a lot of them turned into either calling their doctors back, maybe they had a friend or family member to help them, or the new finding in this research was social media, social platforms, Google, internet, which is not previously sought out in literature. So this was a brand new finding in this research. Supports during their transition. Latino caregivers indicated not having much support. Majority of them felt alone. Some may have had of either their medical doctor or a family friend or family member be a support, but the majority did indicate not having adequate support during transition time. Challenges during transition time. A major hardship was the financial hardship. Do I take my child to an appointment and miss my job and not make money for the day for my family? Or do I not take them to the appointment knowing that that might delay their medical condition? So these were personal hardships during as a challenge with their child. Also, other challenges, delays in services. Medical specialties may not take the insurance. Or the other factor is your child's 18, the insurance drops. You have to now apply for the insurance of the child by yourself. So that's also what's going on right now. So the final finding is related to recommendations. All the Latino caregivers who were interviewed all had recommendations. One, to communicate with your child early. Talk about them, what it's like being an adult with a disability. The other finding that was indicated was educate yourself as a caregiver early on and not waiting for that line at 18, your child needs to leave the pediatric system. Educating early in life. Different Latino caregivers were trying to figure out for themselves if they wanted to learn when the child was 13 or 14 versus 16 or 17. So I think the overarching statement is educating yourself as a caregiver, of knowing what's to come after your child is now an adult is going to be very important. The other piece is when you're learning about navigating, use different supports. Get yourself in a support system, support group, or use the social media platforms. It also is another support for you, as that was something new in this finding, that some of our caregivers had to take their own initiative, and as a recommendation they said try to use their support systems, your support groups, and social media, Google, internet to help you with that transition so you're not feeling alone during this transition time. So with all this information, valuable information, I want to share this with everybody in the Lehigh Valley, Lehigh and Northampton, especially the county level. We need resources to be brought back into our community to help our families, whether they're Latino or not. All our caregivers with children with disabilities need the funding that's lacking in our area. As we've noticed, pediatric funding is very saturated. It's very saturated, which is wonderful, but we also need that same saturation in our adult funding as well, because there are long waits and there are delays in their treatment, which added to some of the challenges with the caregiver transition that we want to decrease, so our caregivers who are already under stress, another set of stress because they have a child with disabilities, can transition with less stress in their life and be able to educate their child to function appropriately and normally like anybody else in our communities. But we need support and funding from everyone to help us with that cause.